And good evening to eminent speakers, delegates, ladies and gentlemen. Thank you for joining our side event during the 64th CNE conference entitled World Challenge and Drug-Free Workplace Program organized by Green Crescent Malaysia. I'm Dr. Balkis Mohamed Kasim, Secretary of Green Crescent Malaysia, will be the chairperson for today's event. First of all, I would like to welcome our panelists today, Ms. Embassy Dato Ganeson, Sivagurunathan, Permanent Representative of Malaysia to the United Nations and other international organizations in Vienna, Dr. Ahmad Fairuz Mohamed, President of Green Crescent Malaysia, Dr. Norli Abdul Jabar from International Federation of Non-Organization for the Prevention of Drugs and Substance Abuse, Mrs. Amy Ronshausen from Drug Free America Foundation, and also Ms. Fatma Çamlıköylü from Turkish Cypriot Green Crescent Association. Thank you for joining us today. So without further ado, I would like to introduce our first speaker for today's event, His Excellency Dato Ganeson Sivagurunathan, Ambassador of Malaysia to Austria, with concurrent accreditation to Slovakia and permanent representative of Malaysia to the United Nations and international organizations in Vienna. Graduated with Bachelor of Arts with Honours in History from University Malaya, Kuala Lumpur, Malaysia. Advanced Diploma in Business and Management from University of Wales, UK, and Diploma in Public Administration, Institute Tadbiran Awam Negara, Malaysia. He was awarded with Ahli Ahmad Shah Pahang in 2011 and Darjah Indra Mahkota Pahang in 2015. He had represented Malaysia at numerous international meetings and conferences on environment, international law, peacekeeping and terrorism, and has developed certain level of expertise on those issues. Now I would like to welcome Dato to deliver his opening speech. Thank you.
Thank you very much, Dr. Balkis. Dr. Ahmad Fairuz Mohamed, President of Green Crescent Malaysia, eminent speakers, excellencies, distinguished delegates, ladies and gentlemen, a very good afternoon to all. I would like to thank and commend the efforts of the organizers of this side event, namely Green Crescent Malaysia, with the support of Drug Free America Foundation and the International Federation of Non-Government Organizations for the Prevention of Drug and Substance Abuse, and Kirbis Tuk Yashali Darni. Yeah, sorry if I got it wrong. For organizing this important side event during this 64th session of the CND. Drug addiction and drug abuse are serious concerns which affect society and public policy in multiple areas. This includes a loss of productive manpower and a taxation on the criminal justice system. Hence, the drug prevention programs advocate prevention measures for individuals from getting involved with the drug and drug trafficking. The Malaysian government remains committed in its drug prevention efforts in the country. Drug prevention measures is practiced in Malaysia to stop individuals from starting drug abuse and drug use and drug abuse. In this regard, we believe that the efforts to promote awareness on prevention at the workplace is key to the drug-free workplace, work-free place. As a matter of fact, this point has been underscored by the Honorable Tan Sri Muhyiddin Yassin, Prime Minister of Malaysia, during the National Anti-Drug Day this year. He emphasized that prevention is better, which brings with it a clear message that the drug abuse can be prevented with the cooperation of all. In Malaysia, most of the government ministries and agencies have already formed a committee to curb abuse among their employees. The setting up of the committee was one of the steps proposed by the National Anti-Drugs Agency in Malaysia. The committee acts as a driving force for the TECAD program, including treatment, rehabilitation, and reintegration to the workplace. NADA encourages employees to make the issue of the drug abuse at the workplace as an important agenda. On this note, I would like to applaud the excellent work of the Green Crescent Malaysia. They have been actively raising awareness at the workplace and in the community. Besides that, they have been empowering the youth and adults with information about drug and drug addictions and promoting drug prevention measures. In this regard, let us all work together to strengthen our resolve and determination in creating a zero drug society. I wish today's event all the success and have a pleasant day. Thank you.
Thank you so much, Dato, for the opening speech. Next, I would like to invite Dr. Ahmad Fairuz Mohamed, President of Green Crescent Malaysia, to deliver his speech.
Alright. Assalamualaikum warahmatullahi wabarakatuh and very good evening here in Malaysia. Okay, first and foremost, thank you very much for all the contribution and Dato Ganeson and all the speakers that contribute to make this success. Okay, so our important topic today that we like to share with you the world progress and challenges of drug-free workplace programs, and President of Green Crescent Malaysia would like to present about the progress in Malaysia about drug-free workplace program. As introduction, as we all know, the substance, drugs, and even alcohol misuse or abuse in an occupational safety and health hazard when it affects the workers in terms of their judgment, in terms of workers' coordination, their motor control, their concentration, and alertness. So therefore, this make that we don't want the substance abuse or alcohol will be at the workplace, as this can lead to injury for the workers itself, and also it will affect the other workers as well and potentially damage to their property and also at the environment. So in Malaysia setting, we have act that focus on the Occupational Safety and Health Act 1994. So under Section 15, and every employer and self-employed person is to ensure as far as practicable the safety, health and welfare at work of his employees. So the substance misuse or abuse can pose major risk to employee safety, health and welfare. Under Section 24, are required to take reasonable care in safety of himself and herself and other person who may be affected by his action or omission at work. So substance misuse and abuse are such a risk factors to that. Other Malaysian law that enforce and related to drugs, which is Dangerous Drug Act 1952, we have Poison Act 1952, we have Drug Dependent for the Treatment and Rehabilitation Act 1983, we have Dangerous Drugs Special Preventive Measure Act 1985, and also we have the Forfeiture of Property Act 1988. So why we need to have this substance abuse and to the workplace? And we must have the drug-free workplace program, policy implementation and whatnot. Because when we have this problem at the workplace, the safety will be compromised. The security at the workplace will be threatened. The productivity of the company will diminish. The quality control will be lapsed. There will be study shows that frequent clinic visit, higher sickness absenteeism, therefore will increase the production cost. of the company. If you can see this, the latest data from our agency, Drug and Substance Abuser and Addict for January to June 2020. And if you can see 96% are male. And because we know that in our setting, male usually a breadwinner of the family. And the ethnicity, Malay, 78%. The age category, from youth 19 to 39 years old, almost 65%. Okay, those who are drug abuse, and 33.8% are adults. So these are the range age of those who are working. So therefore, the drug-free workplace program is an opportunity for us to conduct the program, to do some intervention, and not to penalize those workers who have problem with drug abuse or misuse and whatnot. Okay, if you can see in terms of their occupation, they are workers, and we only have unemployed around 23.8% among them. But among them, they are working in private sectors, 24.6%, and almost 25%. Part-time workers, 21.9%. Yeah, general worker, 14.7%, and self-employed, 12.8%. So from this, we can see that among the drug abuse, and almost 50 to 60%, and they are working. They are at the workplace. So this is the platform that we can do the intervention. So how we share you to you how we can implement the drug-free workplace program at the workplace, because many of the industry, they don't know how to start, how to implement this program. Actually, it is not as simple, and it is not so complicated. So first and foremost, they must have the policy, and they must establish the committee to operationalize the activities of drug-free workplace program. We must educate and empower, give awareness to employee on dangers of drug abuse and why the workforce should be free of drugs. They must understand the purpose of this program. And then we must execute the drug test. We cannot only have the policy, we cannot only have the training or awareness, we must execute the test, the screening. Either we want to implement during the pre-employment, during random, on purpose, okay? And then after that, we must have the system for their treatment, because we know that nowadays we approach the drug abuser. The drug abuse is not a criminal only, it is a disease. Treatment referral to enable employer to assist employees. A drug user should be given help, counseling, treatment, and rehabilitation instead of dismissing them. We not to dismiss them, we not to fire them, and making them a threat to the community. And corporate should support this program and by sponsorship to help credible non-governmental organization in carrying out sustained anti-drug campaign at the community levels. So this same again, the requirement of drug-free workplace program, we must have the policy, we must establish the organization to implement it, and then we must have established the lab. In Malaysia, we have the lab for confirmatory of this all drugs test, and then we have the reliable test drugs kit available, and then the policy and program must make known to all employees at all levels, from the bottom to top level, and training for the personnel managing the program, and treatment and rehabilitation for those who are drug test positive. So NGO contribution on drug-free workplace program, we must advocate and in terms of in the community and also in the workplace and about this program and drug-free workplace program. And then we must channel them for the treatment. We have strong NGO in terms of the drug rehabilitation in Malaysia and other countries as well. So we must link this program to the treatment center, and also we must also engage in the community, because we know the drug issue is not only settled to test the positive and then go to the rehab. We must tackle the macro factors, which is their socio-economic status and their environmental factors and whatnot. So therefore we must also have the community intervention. So what are the challenges of the drug-free workplace program? So whether the testing would be proportionate to the risk. Some of the companies, some of the industry is a small industry, low risk. Some of the industry is high risk industry. Therefore, this industry must look the important to implement, and especially for those high risk industry, moderate risk, must implement the drug-free workplace program. And then at the same time, when we implement, we must ensure the privacy of the patient data, right of their privacy. And we cannot share, everyone know this is the positive, drug positive, no. And then the Personal Data Protection Act, we must take in care. And then we have the reliability of drug test results. And then the procedure for challenging the test result. Because the employees have right to challenge the test results. And then last but not least, how to deal with employees who test positive. The next treatment for the rehabilitation of these workers until return to work back. And we not mean this program is to dismiss the workers, but we want to treat the workers and then return back to work. Okay, with that, thank you very much.
Thank you, Dr. Fairuz, for your speech. Next, I would like to invite Dr. Norli Abdul Jabar from IFNGO. Dr. Norli is a public health medicine specialist in Ministry of Health Malaysia. She holds the experience as a medical practitioner for more than 20 years. She pursues her undergraduate Bachelor of Medicine and Surgery and also her Master in Public Health with specialty in epidemiology at University of Malaya. She had vast experience in managing public health crises such as flood disaster, maternal poisoning outbreak, and currently providing mental health and psychosocial support during the COVID-19 pandemic. She is a subject matter expert in alcohol and substance abuse and had been appointed as the focal person for Global Survey on Sustainable Development Goal, SDG, Health Target 3.5, and other various technical committee. Now I would like to welcome Dr. Norli for her speech. Thank you.
Mute.
Dr. Norli, can you please on your microphone?
Okay, can you hear me? Right, I'll be talking about One Stop Center for Addiction, in abbreviation OSCAR. Before that, first and foremost, I would like to introduce the contents of this presentation. Basically, I will touch on the conceptual framework on prevention of drug abuse or drug addiction, the Malaysia situational analysis in this matter, and also I will talk about international standards for treatment of drugs use disorders, and what is OSCAR is all about, the conclusion and issues and challenges. When we talk about drug and drug abuse, we have to see in the broader picture or the bird's eye view. We talk about supply and demand. And in context of supply, there are enforcers that look into that. But more towards treatment and also prevention on demand side, where we see that there's a lot of risk factors, protective factors that affecting the people that can make them fall or protect them from fall into drug abuse or drug addiction. So in terms of drug abuse, drug use disorder is a public health issue. We have to see in terms of intervention, it must go right from the beginning, from primary prevention, secondary prevention. We have to ensure that they don't fall into further complications, and also in terms of rehabilitation in tertiary prevention. Right, in terms of Malaysia's the situational analysis on drug or substance use disorder, I'm taking this data from National Anti-Drug Agency Malaysia for comparing year 2018 to 2019. As we can see here, the number is increasing, and we can say that about 436 drug abuse or drug addicts in 100,000 population. And majority, as been shown by Dr. Ahmad Fairuz just now, 95.6% comprised by male compared to female. And most of the time, the trend is using synthetic drugs. As compared previously, we are seeing more cases on opiates like heroin and morphine. Right now, more and more cases taking ATS or new psychoactive drugs. And we can see the increasing trend of using polydrugs among them. And majority, those 19 and above that using or falls into drug use disorders. And we can see, even though majority that involved are those coming from either no schooling or primary or secondary education, but we are seeing more cases from tertiary education level that involve in drug addictions. The international standards for we can see that the international standards recommended 7 key principles and standards for treatment of drug use disorders. And it also recommend the models of service organization. And one of them is one-stop shop approach. Sorry. And what is OSCA? OSCA is basically an abbreviation for One-Stop Center for Addiction. And as we can see, there's various types of substances that involve right now. Conventionally, we have heroin and morphine, cannabis. In Malaysia, we have ketum leaf addiction, abuse and addiction as well. And besides that, we have our benzodiazepines like diazepam as such as one of substance abuse. And apart from that, we have inhalant cases involving most of the time the children in northern part of Malaysia and also in Sabah in East Malaysia. And on top of that, we have nicotine in terms of vape and also cigarettes and alcohol, which is freely being sold and easily accessible. We can get it in the speed mart in Malaysia. And what the objective of OSCA is all about? It aims to provide screening, intervention, and also treatment services for the substance abuse and dependence at primary care level itself, which comprise of comprehensive, holistic, and integrated approach that covers all sorts of substance, ranging from opiate to new NPS, marijuana, apart from nicotine and also alcohol and ketum. The justification for OSCA, first, because of the changing trend of drug abuse from the conventional drugs to synthetic drugs. And we know that our medication-assisted therapy that most of the time we use, methadone, is just treating those who use heroin or morphine. But with the new drugs, that doesn't accommodate in terms of harm reduction or treatment. And also we have to address the issue of polydrug user. We can see that studies revealed that there's an increase of consumption of several or multiple illicit drugs together on top of heroin. They use also ATS like ice and shabu. And OSCA also provide holistic, comprehensive, and integrated. We are not only services from Ministry of Health, but also we involve other agencies, namely our National Anti-Drug Agency, and also the Islamic bodies also involved. In fact, inside Ministry of Health, we also involve other disciplines like counselors, the occupational therapists, as well as the medical social worker. And OSCA also address the issues of dual diagnosis. We have to tackle on the drug dependent and mental disorders at the same time, and on top of that, the drug induced psychosis, and also in terms of comorbidities among the drug abuser, as we can see that a lot of cases involve with comorbidity of HIV, AIDS, hepatitis C, tuberculosis, and also STDs. And these can be managed at primary care level. And we have to see that OSCA is community-based, it's not hospital-based. And this serves as a floodgate to control the influx of hospital admissions. And studies also revealed that the importance of psychosocial counseling, early intervention, and family involvement in the management of drug dependence and relapse prevention. And also we have to address the rights of the drug abuser or dependents to be treated and taken care of. And the services provided is ranging from quit smoking clinic, as we already have it in all clinic or the health clinics in Malaysia, and also alcohol screening, brief intervention, refer to therapy, SBIRT. We have already trained and provides in around 319 Malaysia that provides this service, and OSCA will look into other drugs, namely the cannabis or the ATS as such. And we also have the methadone, the MAT, medication assisted therapy services in more than 500 facilities in Malaysia. The operational modus operandi for in running our OSCA, basically we go for screening by using the ASSIST or the alcohol, smoking and substance involvement screening test version 3.1, and also Eureka to see the level of changes in the drug abuser or drug addicts. And we go to the intervention by using the brief intervention WHO and related substance abuse intervention modules, and the referrals depending on the ASSIST score, disease complication, the social issues, and also the rehabilitation needs. And also we have to go for development of monitoring and evaluation system that involve all sectors. And this is how the algorithm is all about in OSCA. First, we receive the patient, whether they are walk-in patient or referral case. We register them, we triage them. If they are unstable, we refer them to hospital for stabilization. And if they are stable, we further assess them using the ASSIST, also the DSM-4 and Eureka. And we go for intervention. Then if let's say they need any referral, we refer accordingly. And harm reduction in Malaysia has proven to be successful and beneficial, especially in reducing HIV infection. This is no longer an issue to be debated. And it is time for us to further strengthen and expand the integrated program into one-stop center of addiction for better impact and excellent results. Joint statement by WHO, UNODC, UNAIDS, United Nations of Human Rights, UNICEF, UNHCR, and UNESCO in March 2012 has stated that to close the compulsory drug detention and rehabilitation centers and implement the voluntary, evidence-informed and rights-based health and social services in the community. Issues and challenges. Whenever that we start anything, there's always challenges that we have to face. We can run on issues of human resource or inadequate resources. We can foresee this. And the most important thing, we have to train to ensure that we have a strong and solid capacity that can run this OSCA. And we need continuous training, enhancing capacity building. We need also a clinician in helping us on this. And also community empowerment in aftercare. I can see there's some lacking in this area, whereby we can see issue of stigmatization, stigma is still, and also discriminating among the drug user is very high among our population. And also strengthening and expansion of our community-based rehabilitation. With that, I thank you very much for your kind attention.
Thank you, Dr. Norli. Next, we have Mrs. Amy Ronshausen, Executive Director of Drug Free America Foundation. Mrs. Ronshausen received her Bachelor's of Art degree from University of South Florida. She is the Executive Director of both Drug Free America Foundation and Save Our Society from Drugs, SOS, a national nonprofit organization that works to defeat drug legalization attempts, promote sound drug policies, and prevent drug use, abuse, and addiction. Mrs. Ronshausen has dedicated most of her adult life to the work of reducing illegal drug use and drug prevention. In her 12 years with Drug Free America Foundation and SOS, she has assisted in coordinating successful grassroots advocacy campaigns to defeat marijuana legalization efforts, organize statewide prevention summits, analyze and track states and federal drug policy legislation, and train prevention professionals at local, national, and international conference. Now, I would like to invite Mrs. Ronshausen to deliver her speech. Thank you.
Great, thank you so much. And is my screen shared correctly? Is that all? Can you see it on there?
Yes, we can see your screen.
Perfect. Okay. Thank you for having me. As she said, I'm Amy from Drug Free America Foundation. And one of the divisions that we have here at Drug Free America is our National Workplace, Drug Free Workplace Alliance. So this is a topic that is very dear to our heart. And I'm happy that on the last day of C&D that we're closing out a side event where we get to talk on this topic. I'm going to start my presentation out with a very short video that we made here at Drug Free America Foundation with the help of funding from the Colombo plan. So I'm going to, hopefully this works right, and I'm going to go ahead and press play.
Most companies make every effort to provide a safe, healthy work environment for employees. Yet substance abuse and addiction have become very real threats for many of them. Data shows in the past year, over 9% of full-time workers were dependent on or abused alcohol or illicit drugs. That translates into a steep drop in morale and productivity and an increase in absenteeism and accidents. In some countries, companies are losing billions of dollars a year. So what can be done? Well, the most effective way to prevent alcohol and drug-related consequences on the job is through a drug-free workplace program. It gives employees the support to get help and allows those in recovery to maintain their sobriety. When both management and staff are involved in the program's design, review, and enforcement, it can be incredibly effective. Here are 6 steps that your company can take to create a drug-free workplace. Assess the needs of your company. Develop a policy involving key stakeholders. Educate employees. Train supervisors. Create an employee assistance program. Implement a drug testing protocol. Employers that follow these steps can dramatically improve the safety and well-being of their workforce. For more details and other useful resources, visit the National Drug Free Workplace Alliance, the division of Drug Free America Foundation, at ndwa.org.
So what I'll do is I'm just going to quickly go over some of the steps that were in the video. Is everything? So one of the things that we talked about was, and the video was developing a policy. So the main elements of the policy of an effective program are making sure that you're setting goals, you're defining expectations and prohibitions that are within the policy, a dissemination of the strategies of the policy, and the benefits, assurances, and also consequences and appeals when it comes to how the policy will be implemented. One of the big points, and this was covered also by the other speakers, is that we educate the employees about the policy. So you want to make sure that you're communicating the value of employees in the workplace, because it's important that they feel that ownership and their value, but also the hazards of substance abuse. Explain the benefits of avoiding substance use, and employee education should also provide materials on the risks of misusing alcohol, prescription drugs, and other drugs in the workplace, and should inform employees on how to avoid substance use problems, as well as providing general health promotion information on topics such as stress management, which is something we could all probably use now during the COVID-19 crisis, healthy eating and fitness, because all of these healthy lifestyle things that if you adopt those, you're going to be less likely to your body that would be harmful. And then we also have supervisor training. And this is also we want to make sure that supervisors are trained on the policy and program that you have. You know, they have to
Ms. Amy, can you please unmute yourself? We
Yep.
don't hear you.
Okay, just did. Is that good?
Yeah, it's good. Thank you.
Perfect. So I was talking about supervisor training. Supervisors should be able to recognize any kind of potential problems, be trained on the correct documentation on how to address any issues that arise with employees. And their training should also include how to make appropriate program referrals to the different opportunities that are available to them, either through the employer or in the community. And then how to reintegrate that employee into the workplace once they've finished whatever it is that they're asked to do. The other aspect is an EAP program. And for me, this is probably the most important part. So this is an employee assistance program. And I say that it's probably the most important part because it's the part that's really employee centric. An EAP program is something that's purchased by the employer, and it's certainly voluntary. And we do have many employers who don't have EAP programs, but this is part of best practices. EAPs are resources for employees and their families to seek assistance or self-referral for substance use issues and other issues. And then they're also a resource for employers because they can use that to be able to refer any employees experiencing any kind of behavioral, mental health, or substance use issues. EAP programs also allow for that part of a second chance policy or program for employees. And they show employees that they're valued, and it allows them to return to work. And there is a return on investment. And then the last part is drug testing. And this was also talked about. And drug testing is an important part of the program because you're identifying a particular behavioral issue or something that happened in the workplace. And the drug testing allows you to see what the problem was so that you can react on a solution. But it also, you know, when we're looking at our global partners, there's some legal issues when it comes to drug testing in certain parts of the globe. And then also it is dependent on the type of job that the person has. But when you're doing the drug testing, you want to ensure that there's privacy, confidentiality, the ability to disclose that drug use to the employee and to the employer, a chain of custody and certified collectors. Just trying to move. Okay, there we go. And so the drug-free workplace programs have many benefits. And when we're looking at it from a prevention perspective, this is a great opportunity to boost any kind of community prevention efforts. We work a lot with different NGOs and anti-drug community coalitions, and this is a great way to combine the two and allow that outside influence onto your workplace on some of the great activities that these community anti-drug coalitions are doing. And it's a great place to educate on the harms of substance abuse. You have a ready-made audience, and what a great place to share all the resources that our partners have with the people that are in your workplace. For example, this morning I saw on social media a new resource from ISAP, and it was about parenting and working with youth and caregivers in the era of COVID-19. And what a great resource to be able to share through our workplace. And it's also the opportunity to encourage health and wellness. There's all kinds of different programs out there that do this, that can be shared and support recovery efforts. And when you have all of these things in your workplace, it really helps your business to grow. One of the things I wanted to quickly cover was a challenge in the workplace. So as the drug policy landscape changes, there are definitely challenges that come up with that. And one of the challenges that we're facing in the US, and I'm sure it is not unique to us and it's being seen in other places in the world, are the complications that arise with the legal marijuana market. So pictured here, you see some of the products, marijuana products that are on the market and available for purchase in states that have legalized these things. So as you can see, this isn't the old school joint that you would recognize if somebody was using in the workplace. These are cookies, candies, granola bars. So if they weren't in these packaging, how would you even know if an employee was using in the workplace? Because they are not going to have that stench that comes along with the burning of a marijuana joint. So this is why it's so important to make sure that the supervisors and management are trained in signs of impairment, because that person walking by you eating a candy bar or granola bar could be ingesting a high potency product that's going to kick in while they're still at the workplace. And in the US, there's been some studies and research done on this, and according to Quest Diagnostic, which is a drug testing index, in the US, states that have legalized marijuana have a 43% increase in positivity rates in the workplace. So this is significant and something that we need to be aware of. And then also another challenge that is new, fairly new over the last 12 months are what are the challenges that come with a drug-free workplace program when we've shifted to working at home? Traditionally, people that worked at home were more contract employees, so they might not have been held to the same kind of policies that your employees that were inside your building were held to. But now many of us have been forced to work at home, so that it isn't just a benefit anymore. It's something that comes with our everyday work practices. And we've seen that throughout the pandemic, there's been a significant increase in the consumption of alcohol and other intoxicating substances. And, most of us that are working from home aren't doing that within a 9 o'clock to 5 o'clock time span anymore. So how do you have a conversation with your employees to make sure that although they're at home, they can't just open a beer or smoke a joint, that these are behaviors that, although we certainly don't condone, when they're in their home, we can't control what they do, but they're still representing the workplace. Although they might not be in a safety sensitive position, imagine dealing with a side event when you're intoxicated or emails when you're intoxicated. You're still representing the company. So you want to make sure that those same drug-free workplace policies are adhered to when your employees are working at home. And this is probably something we're going to deal with for some time to come. And I imagine that organizations are going to come up with some really good materials and resources for employers dealing with these kind of situations. And then just the last thing that I'm going to touch on is recovery ready workplaces. And this is something that I think is really inspiring, and it's something that is growing. It's a growing trend. And a recovery ready workplace it means that the organization is mobilizing to address employee policies, practices, stigma reduction for people who are affected by mental illness and alcohol and other drugs. It allows employees and their families that are impacted by mental health illnesses or substance abuse disorders to have universal access to quality, effective prevention, intervention, treatment, and recovery programs across the continuum to help achieve and sustain recovery, health, wellness, and that connectivity to their workplace. So you see a lot of workplaces moving from the happy hour settings and really doing things that encourage health and wellness with their employees. So instead of everybody meeting for martinis or drinks after work, they're meeting for something that, you know, is more centered around health, and they're not encouraging those kind of behaviors. But then they're also supporting the community efforts that are growing around the recovery movement and just that choice to be drug-free and to be sober for reasons of health. So this is an exciting growth, I think, in our area. And then so just the important takeaways, and I think that this has been said by all the speakers so far, is that these policies aren't meant to be punitive. We're not looking to find people who are doing bad things and dismiss them from the workplace. We're looking to make sure that all of employees are happy and healthy. And a way to do that is to provide these resources for them. You know, sometimes there are consequences because we can't have school bus drivers taking our kids to school while they're intoxicated. So there are rules, but we want to make sure that there are opportunities to get people help and that they can return to the workplace because, you know, each employee is a significant investment and they are meaningful to the well-being of the company. And it's just a really great way to support health and wellness, including supporting recovery, which I mentioned. So that was just all I had to share. And then there's just a couple resources here for you to add to your list of many different places where you can get this great information. So thank you very much. And thanks for allowing me to be a part of this great event. I will stop screen sharing there.
Thank you, Mrs. Ronshausen, for your speech. Now I would like to welcome Ms. Fatma from Turkish Cypriot Green Crescent Association. Ms. Fatma holds an MBA degree with a 5-year working experience in private sectors in management positions. Currently, she is working for Prime Ministry Office since 2012. Ms. Fatma was a founding member and the president of Turkish Cypriot Green Crescent Association. Her professional working life and her NGO activism goes hand in hand with her career. Ms. Fatma, we welcome you for your speech. Thank you.
Thank you, Balkis. First of all, I would like to add some small brief information about my island and the North side of the island as well. You will see from my first slide some little history of the North state, and then you will see geographical and historical background of the island. I'm just skipping these because I would like to come to our specific subject, if you like. So that's why I'm skipping these. The world progress and challenges of drug-free working places. This agenda, this topic is very new in my country, if you like. Under these, you will see we have some legal and illegal drugs like the other countries as well. According to our laws, the illegal drugs and alcohol use at work progress. Yes.
Tam verin isterseniz slide ekrana.
Nasıl?
Slide ekrana tam verin isterseniz aşağıdan.
Tamam. Tamam mı Kemal? Is it okay to everyone?
Sol üstte bir play tuşu var. Oraya basarsanız olacaktır Fatma Hanım. Dosyanın ekle kısmının üzerinde. Tamam. Tamamdır.
Free working places subject is very new in my country. I mean, in the north part of the Cyprus. Well, I believe that we should increase the awareness of the employees and employer as well. Under this subject, for example, ethically in my country, if you are using alcohol and drugs, and in the case of the working life, you can lose your job as well, especially in the private sector as well, for example. So as an NGO, I mean, we should believe that increasing the employee awareness, and also we should increase the employees' rights in the working life is most important for us. At the same time, increase the awareness of the employer. For example, I would like to give some example in our working life. We, as an NGO, Turkish Cypriot Green Crescent Association, we formed a consultancy center in the north part of the Cyprus with the aid of the Turkish government. These consultancy, under this consultancy service, we are giving the whole population of the country under the subjects tobacco, alcohol, drugs, and technology and gambling addiction, for example. What we realize under this center is that you are going to stigma. Stigma is most important, for example, in our culture. One of our silence family, for example, shared some experience for us. What was that? This was about the drug addict. She has a drug addict son, for example, and she lose her job because she went with her son to the court. Can you imagine? So this is most important problem under the in the case of the country, increasing the awareness of the maybe the politicians, I mean, especially as I said before, the employers as well. So most of the drug addicts, even in the working place, they are keeping secret these. They are not telling. So you see that it is important to cleaning the, being healthy in the working life, because being healthy in the working life as in mentally means that being productive. So this is most important as well. If I am a manager, for example, I'm thinking to feel free and healthy people, because healthy and happy people, as Amy told later on, means productivity. So in the case of our country as well, the traffic accidents is most important in the case of the small population, for example. Under this traffic accidents, we should look at the drug and other substances as well. But unfortunately, the drug testing is not legal in our country yet. We should do some advocacy as an NGOs, as an non-governmental organizations on that. So this is a hard as well. We should do many things under this subject. When I look at the general information about drug-free working places, I got some information. I got many information in order to increase my awareness on that issue as well. So I am thinking when some of the when our country will normalize, little normalize, I will go or call some of the partner NGOs in order to increase their information about this issue as well, because we are believing that it is most important to believe in people under this subject as well. You will see here the numbers of our silence, depending on the last year, if you like. So when we consider the total number of the population, it is reasonable, I mean. So you will see here, I just would like to put some of the beneficiaries under the subject. And challenges. Yes, it is hard to implement to alcohol because it is part of our culture. I mean, it's normal attitude. Drinking is normal attitude, unfortunately. Changing a habit might be difficult if this habit streams to a particular, potential stigma, as I mentioned before. And drug testing, testing regular employees, the component of the legal issue, at the same time, the awareness of the employer as well. So this is all in a small time period. I just can put on these. Thanks to all.
Dr. Belkıs, I think Cyprus Green Crescent has completed the presentation.
Yes, thank you, Mrs. Fatma. Now I will open the floor to questions from the participants. We have questions from, Mr. Kumaran Nagapa, already answered by Mrs. Amy. So I will read the question. So what are the strategies and steps we have in plans to tackle drug addiction in the new working norm, which is work from home and the fast growing gig economy jobs that provide remote working schedule for staff? So Mrs. Ronshausen has already answered. Because it's a newer issue, I have not seen any detailed strategies yet, but we could recommend the following. Adopt a drug-free workplace policy, and if you have employees that have moved to working at home, send them a new copy of the policy and explain that this is still in effect. Also have any new contracted employees sign that they are aware of the program and agree to follow. For random drug tests, you can still set up time for them to do that remotely. Lastly, I would say to share more information with them on the impact of drug and alcohol use so they are better informed. Another question from the floor is this is from Eilish Brannan. Hi there, thank you for this side event. My name is Eilish Brannan and I'm the Executive Director of Youth Rise. I have a question for Amy. You have mentioned in your video that 9% of Americans have alcohol or drug dependency disorder. Do you have any figures on whether this has increased or decreased? Or any other figures outlining how successful these programs are? Separately, I would also be interested to know your opinion on people testing positive for a substance despite only being under the influence of the substance while they are not on the clock.
Okay, that's a lot in there. So I'm looking at it in the chat to make sure I'm going through it all. So the 9% was actually from the World Drug Report. So we know that those statistics are often a little dated because it takes a long time to collect all that data, especially when you're looking at global numbers. So I can tell you that that number has definitely increased, especially in the United States during the pandemic. We have seen a significant increase in people that are diagnosed with a substance use disorder. Unfortunately, we have seen a significant increase in the amount of people that are dying of drug overdoses. And we know that drug consumption rates have increased during the pandemic. And research has previously showed that, you know, it's not in any times of kind of social or economic upheaval that these things increase, because you have significantly increased risk factors. When people sometimes lose their employment, they're suffering from significant grief because of the loss of just personal freedoms that have come along, that have been taken away with stay-at-home orders, but also the grief and the amount of people that we've lost through COVID-19. So all of these things, you know, can increase those risk factors. There have been a lot of studies done on drug-free workplace programs that show their effectiveness and things in that area. And if you want to type in your email address to the question and answer part or into the chat section, I'm happy to make sure that I can send you some of those resources, because I don't have them pulled up right now. Let me see, was it really interesting to know if people testing positive? Okay, and then the last part of it where it says people testing positive. So the whole purpose, and I think that this has been said by, you know, all of the presenters, is you're not out there looking for people who are testing positive for drugs. You're addressing behaviors that happen in the workplace. So the whole focus of a drug-free workplace program is that you're making sure that your supervisors, managers, that those people are trained to notice signs of impairment, because you don't want people impaired on anything while they're in the workplace, just for safety issues. So the drug testing is just a confirmation of why that person was having that behavior issue in the first place. It might not always be drugs. It could be that the person didn't get a good night's sleep. So this week I've been waking up at 3 o'clock in the morning every day to participate in side events. So I'm having a significant lack of sleep. And I notice by midday, my behavior is a little more, I'm a little more grumpy. I'm probably not doing my work to the best of my ability because I've just been up for too long. So if I was at a workplace, my employer might notice these changes and they might come to me and say, Amy, what is going on? You know, why are you acting like this? Why are you having, you know, 1,000 spelling errors and everything that you're typing? And then I could tell them about the fact that I hadn't been sleeping, but they then have a right under my drug-free workplace policy to send me for a drug test. And if I test it negative, that wasn't the issue, and they need to figure out a different way to address my problematic behavior, which, you know, I could be made to take a couple of days off to get more rest and better time management, different kind of training that they could put me through. But if I did test positive, then we know that that's the issue that needs to be addressed. So it isn't that, you know, we're looking for people that are testing positive. We're looking for impairment, behavioral issues, and the drug testing is just a confirmation and gives us a way to address those behaviors. So I hope that answered that part of the question. And I got your email address, so I'm writing that down, and we'll send you those studies and links to other research.
Great. Thank you, Ms. Ronshausen. We have another question actually from Al-Hassan Jallah. Thank you for the presentation. I'm Al-Hassan Jallah, working for Foundation for Rural and Urban Transformation in Sierra Leone. Can you please disagree by sex the 9% of Americans that have alcohol or drug use disorder?
Oh, sorry, is that one for me too? I don't have that. I don't have that information. I'll have to go back and look at the World Drug Report and see if they, and that actually wasn't for Americans. That was from the World Drug Report. So that was a global number. I hate to say it, the percentage of Americans that have a substance use disorder is probably higher than 9%. But this was a collective number from a global data. But I can go back and look and see if I can, if they offer the raw data and see if it does show if that is by gender and stuff. And so if you can type in your email address as well, I can look for that and find that out.
All right, thank you, Mrs. Ronshausen. I think that's all the questions that we have today. So we have approached the end of our session today. As part of the organizers team, I would like to express my gratitude to all panelists and participants who have made our event today successful. Thank you, and we are looking forward to our next meeting. Thank you.